Pioneers. I am Artenisa Hamilton, Director of Primary Healthcare Services, and today I wish to focus on the family, and more specifically on the males, be they the head of the home or a son, nephew or grandson, before providing you with the COVID-19 update for May 20th, 2020. You and I know the high value we place on our families in Guyana and the pleasure we derive from the welcoming and comfortable arms of our loved ones. So it begs this question, which I'm addressing directly to the male. Why then would you deliberately want to jeopardize the life of your family members? Put them at unnecessary risk by contracting the coronavirus disease because of your reckless behavior. Most of you are acting as if COVID-19 cannot touch you, that you are beyond its reach, and that the health guidelines are a waste of time. I know many of you are macho and perhaps think that wearing a mask makes you seem less of a man. But there are times when you must put that pride aside and exercise wise judgment. This is the time because COVID-19 is a silent killer, and complying with the control measures is of paramount importance if your family is to be safe. From our reports, you would have been hearing that the ratio of males to females positively confirmed with the disease is significantly higher. Today, it is 71 to 54. And of those who have died, 8 out of 10 are males. Further, the age group under the lens is the 16 to 59 age group. So my dear males, I am sure that you want to be around to hug and kiss your loved ones at home rather than be 6 feet under the ground in a cemetery somewhere. COVID-19 will mash you up and break up that same home circle in which you find comfort. So don't wear the mask on your chins. Don't sit way up under your friend. Give him some space. Physical distancing is a must, and get off the streets before 6 p.m. Home is the best and safest place. Stay home. Now for the global report. Globally, the statistics according to WHO are as follows. Total number of cases is 4,731,458, with 316,169 deaths. In the region of the Americas, the total number of cases is 2,082,945, with 124,668 deaths. The situation in Guyana as of the 19th of May 2020 is as follows. We are reporting no new cases today, and so our number of confirmed cases remains at 125. To date, the total number of persons tested is 1,295, with the total number of negative cases being 1,170. We currently have 47 persons that have recovered, 68 active cases in institutional isolation, 3 patients in the COVID-19 ICU, and the number of COVID deaths remains at 10. Residents of the Upper Takatu, Upper Essequibo, we continue to advise you to be watchful and careful, as Brazil has now become the country with the 3rd highest number of confirmed coronavirus infection cases in the world, after registering a total of more than 250,000 cases. You remain extremely vulnerable, and therefore every resident must be prepared to be his brother's keeper in order to ensure the safety of everyone. Today we have with us Dr. Onika Scott, Maternal and Child Health Officer, who will be speaking to us about some of the most commonly asked questions relating to COVID-19 and pregnancy that may be on your mind. Dr. Scott?
Thank you, Dr. Hamilton. I'm Dr. Anika Scott from the Maternal and Child Health Department, the Ministry of Public Health. And during this conversation, I will address some of the most commonly asked questions relating to COVID-19 and pregnancy that may be on your mind. Guyana has in excess of 15,000 births annually, and so there are many of you women, I'm sure, who are wondering how your pregnancies can be affected by COVID-19. You may wonder, am I at greater risk of being infected with COVID-19 because I'm pregnant? According to the World Health Organization to date, and as far as research shows, pregnant women are not at a higher risk of contracting the COVID-19 disease than the general population. That being said, due to the changes in your bodies and immune systems, you can, in the last months of pregnancy, be gravely affected by some respiratory infections, and so it is important to take all precautions necessary to avoid transmission. Another question you may be thinking of is, I am an expecting mother. What should I be doing to keep myself safe during this pandemic? Well, you're advised to avoid contact with anyone displaying symptoms of COVID-19. Avoid public transport when possible. Work from home wherever possible. Avoid large and small gatherings in public places, particularly in closed or confined spaces. Avoid physical gatherings with your friends and family. Eat healthy. Practice moderate physical exercise if recommended by your physician, and get lots of rest. Practice regular hand washing for 20 seconds with soap and water. Practice regular cleaning and disinfecting of surfaces with the recommended detergents. Conduct self-monitoring of any signs or symptoms consistent with COVID-19 and seek early care from a healthcare provider. Is it safe to continue my checkups at the clinics? You may also be wondering. Yes, it is very safe to visit the care centers. No clinics have been terminated, and the antenatal services continue uninterrupted. Currently in Guyana, all the clinics are adhering to physical distancing guidelines. So, you may receive a call from your healthcare provider to reschedule your clinic appointment to a specified time and date. The ministry urges you to keep all of those appointment times as it prevents overcrowding at the facilities. We also encourage that upon visiting the health facility, you adhere to the seating arrangements, respiratory hygiene, and other measures adopted by your facility to stop the spread of COVID-19. Pregnant women in care can call their health facilities for a teleconsultation if they have any other concerns. Another question, is the hospital safe for me to give birth? Yes, all birthing facilities are safe for delivery. In addition, there have been some adjustments and changes at the birthing sites to prevent the spread of COVID-19. All healthcare providers will be wearing a mask when you visit the facilities and other protective equipment. You will also be requested to wear a mask when accessing the services. If I have COVID-19, can I have my baby in a safe environment? Once more, yes. All birthing facilities have made provisions to ensure safe delivery of any pregnant mother diagnosed with COVID-19. At the Georgetown Public Hospital, there is a special location identified for delivery and, if needed, for a C-section. After the baby is born, the mother will also be cared for in a specially assigned space. If I have COVID-19, will I pass it to my baby? At this point, the scientific community still does not know if the virus can be transmitted from a mother to her baby during pregnancy. However, during delivery, the healthcare provider will take all the necessary precautions to keep your baby safe. If I have COVID-19, can I safely breastfeed my baby? As far as we know, it is perfectly safe to continue breastfeeding. It's the best thing that a mother can do for her newborn, bearing in mind that as a mother, you will have to protect your baby from other sources of transmission. To conclude, I want to encourage you to disclose any symptoms that you may have when you visit the hospitals for care. It is in keeping with the objective of providing the safest care for you and your baby. You may contact the Maternal and Child Health Department at your neighborhood health facility or on the ministry's Facebook page if you have any questions or comments. Do remember that your health and that of your baby are of paramount importance in this time, and you have a significant role to play in preventing the spread of the virus.
I do hope that the information that was provided was useful and that our expectant mothers would be more comfortable knowing that their safety is of paramount importance to the Ministry of Public Health. I wish to remind you that the Ministry of Public Health cannot be the only participants in this fight. We need you all to come on board. We can defeat this disease. So I urge you to please observe the guidelines provided and continue to stay safe and healthy. Thank you.